Kidney cancer is among the 10 most common cancers in both men and women. The type we see most is renal cell carcinoma. It's long been difficult to treat and one of those areas that clearly needs continued research. We're focusing on some of those developments this morning with oncologist Robert Figlin of Cedars-Sinai Comprehensive Cancer Center. Good morning, doctor.
Good morning.
Exactly what is RCC?
RCC is a form of cancer that arises in the kidney, starts as a mass, most often is undetectable for months to years, and then when presents, can present with symptoms and signs like discomfort in the flank of your back, passing blood in your urine, but unfortunately most often kidney cancer is found incidentally on an imaging evaluation with a CAT scan or an MRI scan and is somewhat asymptomatic.
Older people are affected more. Why is that?
Yeah, so I think that's true for most cancers. Most cancers increase in incidence and frequency as a population ages. That's true for kidney cancer as well. Certain types of kidney cancer can affect younger people, but as we get older, exposure to certain toxins, smoking, different things that are predictive of causing kidney cancer occur in this so-called aging population.
For everybody, what are some of the risk factors, some of those things that you notice tend to surface time and again?
Yeah, so the first thing to understand is that most kidney cancer we don't know the cause of. For the kidney cancers where we do know the cause, things like having a strong smoking history, obesity, a family history of kidney cancer, or exposure to certain industries like the paint industry, where you might have chemicals in your workplace, increase the frequency of kidney cancer. But to reiterate, most kidney cancers are caused in a way that we're not really entirely clear what the cause is.
Each year there is a huge international meeting with oncologists from around the world. What kind of research was just presented at that meeting that you can share with our viewers?
So every year the American Society of Clinical Oncology meets in Chicago. This year has been a very important year in the history of kidney cancer research. We've demonstrated that both agents that target specific pathways, so-called targeted agents, or agents that activate the immune system are now available to patients with kidney cancer. These so-called immuno-oncology agents are agents that allow the immune system to see the cancer cell, seek it out and destroy it. And we now have evidence that both targeted agents as well as immuno-oncology agents are extending life. And for the first time in kidney cancer, we have the benefits of being able to say to a patient and their family that the things that we can offer can extend life, do it as an outpatient in a comfortable way while maintaining their quality of life.
Unbelievable. Is there a website that has more information about that where you would send folks watching now?
Yeah, I think the most important websites are really American Society of Clinical Oncology website or your comprehensive cancer centers in your community are the things that offer the greatest information about kidney cancer as well as other cancers and the therapies that a patient and family should be aware of as they go down this journey.
Well, some reason to be optimistic here, Dr. Figlin. Thank you for joining us. We appreciate your time.
Thank you so much for having me.
It's our pleasure. Mike, over to you.